Hello, and welcome to the learning series titled Learning Together, Emergency Shelters and Substance Use Facilities. Please note that this session is being recorded. We are pleased to offer French simultaneous interpretation for this session. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your Zoom screen. If you need support at any time during this webinar, you can reach out to one of our producers using the chat feature. My name is Jessica Hodge, and as program lead on this program, I am so excited to be joining you as the host for today's huddle. I would like to start by acknowledging that we are meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, I acknowledge that I am hosting this webinar from Sudbury, Ontario, which is the traditional territory of the Atikameksheng and Anishinaabeg. This territory is covered by the Robinson-Huron Treaty. We recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today. At Healthcare Excellence Canada, we continue on our learning journey and commitment to support improvement with and for all people in Canada. We are pleased to share that this program is delivered in partnership with the Canadian Centre on Substance Use and Addictions and the BC Patient Safety and Quality Council. I want to introduce our speakers for today's event. We have Marianne Notariani, who is the Vice President, Knowledge Mobilization at the recently established Center of Excellence PTSD. In this role, Marianne oversees initiatives to support the application of research evidence and the implementation of evidence-based practices to improve supports and services for veterans, first responders, and their families across Canada. She also provides leadership to the Center's growing network of networks to ensure the expertise of lived and living experience, valued equally alongside technical expertise, is guiding the Center's work. We also have Fardos Hosseini, is the Deputy CEO and Vice President of Research and Public Policy at the Center of Excellence on Post-Traumatic Stress Disorder and Related Mental Health Conditions, located at the Royal Ottawa Mental Health Centre in Ottawa. His research focuses on strategic policy issues related to mental health system transformation, parity legislation, substance use and addiction, and mental health for newcomers and underrepresented groups. I will turn it over to Marianne and Fardos to begin their presentation on the continuum of moral stressors and associated outcomes in service providers during COVID-19. Thank you both for being here with us today.
Wonderful, and thank you, Jessica, for the wonderful introduction, and thank you to Healthcare Excellence Canada for the invitation to speak to you today on this important topic, and a huge thank you for you all for joining this discussion. As Jessica mentioned, my name is Fardos Hosseini, and I'm the Deputy CEO and Vice President of Research and Policy at the Center of Excellence on PTSD, and I'm joined by my wonderful colleague, Marianne. And just like Jessica, I would like to begin by acknowledging that the Center of Excellence for PTSD is located in Ottawa on the traditional and unceded territory of the Algonquin and Anishinaabe people. Next slide, please. So before we get into the specifics of the presentation, I did want to highlight the three learning objectives of this huddle. Number one, we're hoping to explain the concept and the construct of moral injury. Number two is to describe approaches to addressing moral injury in health and social service settings. And number three is to share some resources to support people leaders to implement recommendations to address moral injury. Next slide. A review paper from 2017 extracted definitions of moral injury from the literature and found there were at least 17 different definitions, all with slight variations. The concept of moral injury was developed and named by clinical psychiatrist Dr. Jonathan Shea. And the concept emerged because it captured the experiences of those military members and veterans whose mental health and related concerns were similar to PTSD, but did not meet the criteria for PTSD. And moral injury has been studied mostly in the military and veteran context, but as we will discuss, there is a growing study in other contexts, including healthcare workers and frontline staff. Next slide. So over the next two slides, there are just a few of the definitions of moral injury that are most often cited. Together, these definitions contain core elements of what moral injury is, so what it might feel like for a person. As mentioned, Shea, who worked with Vietnam veterans in the United States, is credited with coining the term moral injury. He He published some of the first works on the topic, which drew on his clinical experience and was instrumental in the development of programs to build moral resilience in U.S. military veterans. Shea describes moral injury as a betrayal of what is right by someone who holds legitimate authority in a high-stakes situation. Brett Litz and his colleagues at Boston University added to this definition. Their expanded definition acknowledges the types of consequences that such actions may bring about. It also emphasizes that moral injury can arise not only from feeling betrayed by others' actions, but from one's own actions where they violate deeply held beliefs about what is right. This is the most cited definition. Next slide. Another definition is the one developed by Gabriele Lettini and Rita Nakashami-Brock. In this definition, the spiritual lens is emphasized, and moral injury as a wound in the soul. The last definition I want to highlight is one from Jeremy Jenkinson. And this definition takes a syndrome perspective. Next slide. It's a combination of all four of these definitions, and mostly Dr. Brett Litz out of Boston University, where moral injury refers to the psychological, social, and spiritual impact of events involving betrayal or transgression of one's own deeply held moral beliefs and values occurring in high-stakes situations. That is what we refer to as a moral injury. Next slide. And there are two broad types of moral transgression events. Number one is moral transgressions that involve people doing or failing to do things themselves. This can be deliberately or unwittingly. And number two is being exposed directly or indirectly to transgressions on the part of someone else. Such events, or these kind of events, are called potentially morally injurious events, or PMIEs for short. And the word potentially is used in recognition that not everyone will respond in the same way to such events. Just as in the trauma field, there's a recognition that individual responses to potentially traumatic events that involve threat to one's life or physical integrity vary, the same is seen in moral injury. Next slide, please. Potentially morally injurious events can be best understood to exist on the more severe end of a continuum of moral stressors and related outcomes. This continuum outlines that moral challenges and stressors are more frequent than morally injurious events, and that moral frustration and moral distress are more common outcomes for individuals. In the same way that not all individuals who experience a traumatic event will experience PTSD, not all moral violation, potentially morally injurious events, will lead to the development of moral injury. Click one, please. So in the milder degree, you may experience morally challenging events which tend to occur more frequently, and these may lead to feelings of moral frustration. Next click. In the moderate degree, people can experience moral stressors or events that cause greater degree of moral distress. These are more acute than moral challenges and are likely to lead you to feel more salient moral emotions like guilt, anger, or shame. And in many cases, this may lead to moral, and this can be a normal response to these events and can be productive in affirming one's moral beliefs and preserving relationships with others. In the third section, which is all the way on the right, this is where morally injurious events are in the extreme degree, and they are located on the right side of the continuum. Morally injurious events are severe, lower frequency events that have a distinct impact on mental well-being and cause more severe psychosocial harms that can impact someone's daily activities, relationships, and functioning. If you experience moral injury rather than moral frustration or moral distress, you're more likely to see yourself as marked by the experience and to define yourself and or others in relation to the events. As mentioned earlier, not all morally challenging events or situations lead to moral distress or injury. Some experiences, although painful, may in fact lead to moral growth because they prompt self-reflection or new insights to strengthen character. Next slide. Also want to just briefly highlight the debate that is going on between PTSD and moral injury. And there's still some conversation about what are the differences and is moral injury effectively captured by PTSD. In the military and veteran population, if you speak to folks who have lived experience, they'll tell you that there's a huge difference between the symptoms of PTSD and the symptoms of moral injury. But still there's debate and there's still research that's needed. I did want to highlight some of the differences. First is the origin or the cause. Events that lead to PTSD involve threat to safety or physical integrity and threat of death. This may not be the case for moral injury. Second is differences around emotional reactions. So guilt and shame are common in PTSD, but fear-based conceptualization of trauma like horror and helplessness and recovery dominate for PTSD. But guilt and shame are extremely central to the understanding of moral injury. So you might see it in PTSD, but in moral injury, it's central. Another difference is the attribution. In PTSD, there's an understanding that negative beliefs resulting from trauma as erroneous or exaggerated, and that's how it's seen, the negative beliefs that from trauma are exaggerated. This may not be the case for moral injury. And the example of this is individuals may have really committed abuses which are wrong, and the person should be held accountable. The fourth difference is physiological stresses. So symptoms of exaggerated arousal, which is commonly seen in individuals struggling with PTSD, may not be associated with moral injury. So exaggerated arousal is a central symptom of PTSD. It's not something you may see in moral injury. And then the last one is functioning of symptoms. So avoidance is a core symptom of PTSD. And we may see it in moral injury, but instead of avoiding reminders to experience, they may avoid social judgment for fear of being found out as a morally bad person. So avoidance is there, but the avoidance level is different and the avoidance characteristics. Next slide, please. So the full range of moral stressors has been seen around the world during the COVID-19 pandemic. At the least severe end of the spectrum, many of us have experienced the moral challenge of witnessing the behavior of other people that we consider wrong and work against the interests of society as a collective. Examples of morally challenging behaviors include the hoarding of food and toiletry basics and people breaking physical distancing rules. Our emotional response to these behaviors may be frustration or even contempt for the other. These moral emotions are likely to be felt more keenly by those such as healthcare workers who are on the front line of the pandemic and making personal sacrifices for the greater good, but they are still likely to be fleeting or relatively short-lived. Some have experienced more severe moral stressors. For healthcare workers, this may include being caught in the midst of a moral conflict between a preparedness to put oneself in harm's way to help others in need and the natural desire to avoid infection for the fear of consequences for oneself or one's family. With the well-documented shortages of PPE internationally, the tension between self-preservation and the need to treat critically ill infection patients may result in the ethical dilemma of whether or not to render aid. And workers have expressed fears about inadvertently spreading the disease to patients, friends, families, and others. And due to extensive quarantine requirements, some healthcare workers may be forced to quarantine when they're clearly needed at work, placing additional stress on their already stretched colleagues. The requirement to quarantine from family for weeks at a time places additional stress on themselves and their family. Moreover, we also know that the opioid crisis has sadly gotten worse during the pandemic, and our frontline healthcare workers are trying their best to help the community while also being tasked with dealing with the complexities of COVID. And what's happening even more recently, unfortunately, some of the healthcare workers have also become the target of hostility and aggression from members of the public, leading to recommendations not to wear uniforms or scrubs outside of hospital. And such moral stressors are likely to give rise to moral distress, including anger and shame that may be more persistent, may even lead people to question their and others' fundamental values and beliefs. As you can see in the context of COVID, many healthcare workers around in the world are facing the type of severe moral stressors that would be considered potentially morally injurious events. And what we need to do is better prepare ourselves to help support the community while we can before this gets worse and worse. So last slide, just before I pass it to Marianne, is where these potentially morally injurious events lead to enduring psychological, social, and spiritual harm with adverse impacts on mental health, relationships, and quality of life, we would say that a moral injury has been sustained. But ultimately, this is the definition that is being used widely right now. When you have this occurring to you on over a long period of time, that's when we can say a moral injury has been sustained. Over to Marianne.
Thanks. Next slide, please. So it's important to recognize too that while some people exposed to moral stressors may experience significant distress and injury, others may experience post-traumatic growth, including improved psychological resilience, increased esteem, compassion, and engagement. Next. So although individual factors influence response to stressors of all kinds, and adaptive coping is an important part of the approach to managing those PMIEs at work, the literature consistently shows that individual factors are outweighed and are influenced by the organizational and social context. So a whole of organization approach is recommended as best practice to managing PMIEs and mitigating the risk of moral injury. The impact of inherent risks can be minimized by preparation, management of exposure, job design, leadership, and team cohesion. Also, social support, both internal and external to the work environment, has consistently been shown to be a protective factor towards the development of post-traumatic stress and other mental health conditions. And peer support in particular has been shown to be an important protective factor following trauma exposure and is another important consideration in an organizational framework. Next. So moral stressors are inherent in the COVID-19 context and can't be designed out of the work. The onus is on organizations to implement a preventative and early intervention approach, which can reduce risks and maximize protective factors rather than simply reacting to issues when they come up. So a whole organization approach requires responses at the organizational, team, and individual levels. Next. So at the organizational level, we have a list of recommendations here, many of which align with the WHO's guidance that was issued on how to support the mental health and psychosocial well-being of healthcare workers during the pandemic. Some recommendations include establishing evidence-based policies to guide ethically difficult decisions, such as the allocation of scarce resources. Also, it's recommended that workers outside of direct client care make these decisions where possible to reduce the moral and ethical burden on frontline workers. Other things that organizations can do include actions such as enabling flexible schedules where possible, or partnering less experienced staff with more experienced staff, and facilitating access to psychological support. So whether that's through occupational health services or employee assistance programs, or even offering information about resources that are available within the community or free resources like those available through Wellness Together Canada. Next. So we'll look at the team level next. Research has shown that cohesive teams with high morale may be better able to protect members from the adverse impacts of extreme moral stressors. So team leaders have a critical role to play. It's important for team leaders to acknowledge the inherent moral stressors for frontline workers during the COVID-19 pandemic. Open communication between colleagues and from leadership about what is known and unknown is crucial, especially when uncertainty and changing guidance has been a source of stress. Managers and supervisors can also support staff through frank discussions about the moral and ethical challenges their staff will realistically face. So team leaders can also help team members make meaning of moral stressors by taking the time to talk through a particular situation or event, acknowledging the moral dilemma, and reinforcing the value and importance of the work being undertaken. Team leaders should also be aware of the potential for staff to avoid talking about moral stressors and be prepared to reach out and proactively offer support rather than wait for staff to come forward. And in offering support, leaders can listen out for narratives, beliefs, or statements that suggest someone may be struggling with a sense of moral failure or guilt, and help them to stay grounded and focus on aspects of the situation they can control while acknowledging what they can't control. Providing acknowledgement and affirmation and giving meaning to events in such a way that reduces feelings of powerlessness helps to reinforce the mission and a sense of purpose. Also, in addition to arranging those regular check-ins with staff to monitor well-being, it's important for team leaders to facilitate referral for further support or counseling if required. Next. Click ahead. So, in addition to the right support at the organization and team level, there are several ways in which individual staff can be supported in their ability to cope with moral stressors associated with the pandemic that we have listed here on this slide, including things such as psychoeducation about moral stressors and moral injuries, which may be helpful in encouraging workers to make meaning out of their experiences rather than avoid or dwell on moral emotions such as guilt or shame. And there are a number of trauma-informed strategies to assist individuals, and these can include stress reduction activities that I'm sure many of you are aware of, such as mindfulness, meditation, exercise, and breathing. Also engaging in social support, recognizing traumatic or moral injury reactions such as avoidance, emotional numbing, and shame, and also encouraging and engaging in that early help-seeking behaviors. Next. So we recognize that there's responsibility for community and government for how we treat various groups of frontline workers and the narratives that have been created around difficult choices that they may have been forced to make. We also have to recognize how this pandemic has shone a spotlight on overburdened or inadequate systems and public policies. And like Firdaus mentioned earlier, we've seen that with how the opioid crisis has worsened during the pandemic. So there needs to continue to be a push to look at those broader systems. Next. And I'll shift gears now to highlight some resources. Thank you. So we developed the Guide to Moral Injury with Phoenix, Australia as a practical resource for healthcare workers and organizations to better understand the range of moral emotions arising from the pandemic. And this provides that framework or map for how to implement preventative and early intervention structures to support workers before they're morally injured. So you can go to the website to download the guides in English and French. Next. The initial guide didn't include an explicit lens on how racialized communities have been disproportionately affected by the pandemic. So we produced a supplement with a corresponding infographic to describe how the pandemic has created and perpetuated stressors that can further weigh on racialized frontline workers. Both bilingual resources are available for download at moralinjuryguide.ca. Next. We're also involved in a number of moral injury research projects, including one where we're partnering on a qualitative study to hear from healthcare workers from across Canada to better understand the types of situations they're experiencing that are contributing to their mental stress. This summary document shares top 10 preliminary findings, which we'll send after. It's currently being translated, and so we'll follow up with you on that. And also to note that the study is recruiting participants in healthcare to complete an online survey. So you can look into that and share across your networks. It will be included in that document. Next. So along with the Moral Injury Guide, we're developing additional tools and resources that can support leaders across a range of settings. Next. So we'll be building an online toolkit that will be launching very shortly on our website and will grow over time. And it'll include things like tools for asset mapping. The purpose of these tools will be to help leaders recognize and promote existing practices, policies, and programs that already support employee psychological health and safety, because we recognize there's a lot underway in many organizations that can support that whole of organization approach I was speaking to. And we'll also be developing a suite of brief practical tools like videos and tip sheets that can support the implementation of the Moral Injury Guide recommendations. So again, launching bilingually very soon, and we'll follow up with all of you around those. And then to our last slide, so we can leave some time for your questions.
Great. So thank you, Marianne and Firdaus. If you have any questions or comments, please feel free to share them in the chat box. For those of you who would feel more comfortable reaching out to a member of our team, you can send your message directly to myself, Jessica Hodge, in either official language, and we'll make sure that your question is asked as well. So just give a couple of moments to see if any questions come through. I did receive one question. Is there anything unique about the COVID-19 pandemic that we should be aware of as managers when we support our staff?
Yeah, I'm happy to take that, and Marianne jump in after it. I think something that's been highlighted in a lot of our research and even our conversations is the healthcare community has flagged for us that there was cracks already in the system, and that the COVID pandemic actually just brought those to the forefront. So a lot of the work that needs to go in is to address some of those systemic issues and how we can better prepare and support healthcare workers that are already overburned, that are already putting in extra hours. And COVID has just added to that pressure. So I wouldn't say that there are obviously unique situations, with how there are shortages of PPE. There's, people being fearful of a disease that they don't fully understand. There's that public perception of folks, negatively protesting outside of hospitals. There are specifics that we need to be aware of, but also important to address some of the underlying issues that already existed from our system and that led us to this place. So I think it's important to capture both perspectives. So how can we make policy changes and recommendations from that perspective, but also what can we do now before this gets worse? So Marianne, I don't know if you have anything additional there, but I think that's important to highlight.
Yeah, exactly that. And we recognize that for different workers, they're going through different experiences. What we've seen through, the past almost couple of years is really that importance of managers and leaders communicating, we have your back, and showing that support and being able to recognize those experiences and having those conversations. And so that's something we've been hearing about, which is why we've developed and have been working towards developing some tools just to help leaders to recognize that. And a lot of this and the tips and the tools that we're looking at are practices that support, fostering employee well-being generally. So again, what we've seen through the pandemic is that organizations who've been paying attention to this and have some of these practices already in place, that can be a protective factor for navigating some of the challenges that have been surfaced through the pandemic. So we just add that piece that it really is important to maintain those open lines of communications, express that support, really show we have your back. Again, look at what's in one's control, what's not. And to Fardoz's point, we know there's some systemic issues that have just been exacerbated and highlighted through the pandemic. And so it's important to be continually paying attention to those organization-wide practices and trying to get ahead of it, as opposed to, trying to react as challenging situations come up for staff.
Great, thank you for your response. One more question that came through. Have you done a gender analysis as part of the process when creating your tools, as many of the workers in the healthcare sector are women? So in other words, are your tools taking into consideration gender-specific supports and requirements?
Another great question. So I'll start off with just highlighting that there's two research projects that we have underway right now. One is the qualitative study that Marianne highlighted, and there's another that we're doing with the OSI clinics across the country, so operational stress injury clinics, to better understand what healthcare workers are going through. And that does have that gender-specific lens in the analysis work. So once those results come to fruition and come to light, we'll be sharing that widely. But the current moral injury guide that was developed, it was leveraging what existed in the literature and the evidence. So as I mentioned, the moral injury construct started in the military veteran population. So we felt responsibility to come out and at least offer a guide for folks that were in the healthcare community. So that guide that currently exists is based off of the best evidence in the literature and in the research. But there are two projects that we have ongoing right now that we're hoping to leverage to kind of build even additional pieces for a research lens. So, and then I think on the tools, maybe I can speak to that.
Yeah, absolutely. And with those projects underway, we'll be looking to actively mobilize those. And I think, Deborah, that's a phenomenal and very important question. So in the suite of tools that you'll see soon that are going to be released, there isn't a specific tool for that. However, it is important for us to even raise that question and to support that awareness raising amongst leaders that there are differential impacts potentially. So not only will we want to talk about that is validated by research that we're doing, but even just support folks in being mindful of that approach when they're looking at their workforce and considering the needs. And so some of the tools that we're developing now really speak at how to develop plans and put in place, practices that are tailored to one's organizational context. So that would be an important consideration that a manager, leader, organization would need to take into account. And I actually love the question too, because as I mentioned, this isn't something that's just going to be launched. We're continuing to work on it and refine it. And we can take that back to the team and see how we might build that into the resources we create.
Great. So thank you, Marianne and Fardos. Following this conversation, we're also sharing a resource which may be of interest to the group. And so ECHO, Coping with COVID, is a free virtual education and capacity building program that aims to promote resilience, provide skills and resources, and build a community of practice amongst Canadian healthcare providers currently supporting the COVID-19 pandemic. For more information, including how to register, you can visit the website that is linked in the chat. And this flyer will also be available on SharePoint if you would like to read further. Please note that this resource is available in English only. Our next learning event will be on October 15th from 12 to 1 p.m. Eastern Time. During this webinar, Dr. Nahid Dosani will discuss equitable care and the palliative education and care for the homeless PEACH program. And our next huddle is scheduled for November 14th from 12 p.m. to 12:30 p.m. Eastern Time with Dr. Bernie Pauly, who will share a 10-point plan to support the implementation of harm reduction practices in substance use facilities and shelters. A special thank you to Marianne and Fardos for today's presentation. Please be sure to take a few moments to complete the feedback polls on your screen. I know more about the continuum of moral stressors and associated outcomes in service providers during COVID-19 than I did prior to attending the huddle, from strongly agree, agree, neutral, disagree. The next question is, overall, I was very satisfied with my webinar experience, again, from strongly agree to strongly disagree. And I will be able to apply what I learned from this webinar in my work, from strongly agree to strongly disagree. Please click submit to share your poll answers with us. And thanks again, everyone. Goodbye for now.